Yes, Lagos. It is 18 minutes gone past 5. You are tuned in to, well, Smooth Health here on Smooth 98.1. My name still remains Joy Ray. And on Smooth Health today, we'll be talking about something and trying to understand what it truly is. You've Some people have had misconceptions, but on Smooth Health, we share information that helps you to stay not just informed, but take charge of your well-being. Now, today on Smooth Health, we'll be understanding stroke because, as you know, stroke is one of those health conditions that it doesn't give you time to think. It just strikes like that, bam. And sometimes, if you're lucky enough, because it literally counts every second, you need to be in an emergency room. There's a lot of misunderstanding. There's a lot of fear, even stigma where stroke is concerned. But helping us to unpack all that and better better informed is the one and only Dr. Abiola Ajayi.
Yay!
Yay! Good to have you in, Dr. Ajayi.
Thank you for having me. I appreciate it.
My absolute pleasure. So Lagos, I'm sure that someone or somehow you've had thoughts about it. Maybe someone you know has experienced it, and you're afraid. You've heard some things that didn't sit well with you. You don't understand it. Well, thankfully, you have Dr. Abiola Ajayi to help us unpack it all, from symptoms you should never ignore to even the myths that you've heard. We're going to be talking about all those interesting things, especially those who like to take some very risky uh, uh, what will I use now? They do some risky things. Let me leave it at that. And that is by taking substances you shouldn't even be touching. But let's get to the basics. Let's start with the basics. Dr. Jai, what exactly happens in the body when someone experiences a stroke? Let's start with that.
Yeah, so stroke is a sudden brain injury from interrupted blood supply. So you can understand that the brain, of course, needs blood, and
Mm-hmm,
the brain is actually very oxygen heavy. So when
mm-hmm,
you
mm-hmm.
interrupt the blood supply, like oxygen demand is heavy, is high. So when you have interrupted blood supply, it causes a stroke. The most common one is something called ischemic stroke, which is about 85% of them, and it means a blood clot will block a blood vessel, and that will now
Okay.
stop blood from flowing, oxygen from flowing, and interrupts the brain. And you have something else called a hemorrhagic stroke, which is where a blood vessel would rupture and it's just
Right.
like a pipe bursting. So it's still going to interrupt the blood supply, whether it's blocked with, maybe somebody poured oil down the pipe or a blood clot, or the
Okay.
blood vessel bursts. It still causes the same thing, stroke. And when you interrupt blood supply to an area of the brain, 2 million brain cells die every minute. So it's and brain cells typically do not regenerate. So once they're dead, they're dead.
That's it.
So it's something that we need to be able to recognize, and it's quite common. 25% risk, lifetime risk after the age of 25. So 25% of people above the age of 25 are at risk for having stroke, which is a lot. You know,
That's a lot. And that's
it's a lot,
scary.
very
That's
much.
really scary.
Worldwide is more women, but in Nigeria it's more men.
Oh,
Yeah,
oh,
worldwide it's women
oh,
that get
wow.
strokes more, just by a little bit. But in
Hmm.
Nigeria, it's
We
heavily
find that it's
shifted
a lot.
towards men,
Mm,
men in Nigeria, because most of them have, this idea that high blood pressure doesn't exist, and uncontrolled high blood pressure, undiagnosed high blood pressure happens a lot here.
okay. Now, let's get into the symptoms. Sometimes it can be asymptomatic, but how can the average person even recognize the early warning signs of a stroke, especially where they're not sure what's happening, but it just happened? Because there's some people that just black out and they're like, okay, I'm normal, it's fine. Maybe I didn't eat, maybe I didn't sleep well, all those kind of things. But What are the things to look out for?
Yeah, there when I was in medical school way back when, we had an acronym called FAST, FAST, and it stood for face, arm, speech, time, meaning time to call for help. If you have anything like face drooping,
Right.
arm weakness, speech difficulty, it is time to get help. Nowadays, we use the acronym BFAST, which adds balance and eye or vision changes. But if you notice
Ah,
any of these things, face droop. I had a patient last week. She was sitting outside my office for waiting to her turn to come into the office. I just looked at her. I said, "You're having a stroke. What's this woman's blood pressure? What's it? Her blood pressure was 200 something over something." I said, "Yeah,
ouch.
quickly put a IV line." So later on, my nurses, my doctors said, "How did you know she was having a stroke?" I said, "Because I saw the way her
The
forehead was
sign.
wrinkled. The forehead, just her forehead. You know, when you wrinkle your furrow your brow, one
Right.
side of her forehead would wrinkle, the other side wouldn't wrinkle. And that was enough. So face drooping, arm weakness, speech difficulty,
Right.
balance or eye or sudden balance or eye vision changes. Some people have a sudden severe headache. So if any
Oh.
of these signs appear, even if
Mm-hmm.
those signs fade, treat it as an emergency. And that's the key for us in Nigeria, especially. Even if it fades, just
Right.
because it fades doesn't mean that the problem went away. It,
Mm-hmm.
it it may just be your body trying to protect you. But if you have those things, I'll say them again: face droop, arm weakness, speech difficulty, sudden
Mm.
change in balance or an eye or your vision, or you have a very severe headache that some people say is one of the worst headaches in the world. All of these things can be signs you need to see your medical professional as an emergency.
Ooh. Now that is scary. Just sitting there, waiting her turn, and you already could see the signs. Some people aren't that observant, but that's even why we're talking about it because you are not the doctor. Don't assume that you have everything covered.
Yeah.
But
And don't assume
why?
because it got better, because it
Right.
came and went, that okay, that was
That's
nothing.
another thing.
Yeah.
But why is some people say even with your acronym time, what exactly is the time? Why is time so critical when a stroke happens? What should Why should we even be rushing to the hospital?
That's a good question. You remember we said, let's say 85% of stroke is something called ischemic stroke. So that's usually a blood clot that causes it.
Right, right.
So you have about 4 to 5 hours from when the symptoms start that
Hmm.
you can give type of drug, IV drug,
Okay.
that you can now, if you can get the person in that 4 to 5 hour window and give them that drug, and it's the one that's caused by a blood clot, you can oftentimes protect them from any long term effects.
Oh,
And
okay.
remember, we said brain cells are dying 2 million brain cells a minute.
And they
So,
don't regrow, so no,
and they
that's
don't,
a risk.
yeah. So the longer you wait, the more deficit you're going to have to try and make up, at the end. So every
Mm.
saved minute improves outcomes. And in the US, we target door to the needle less than an hour. So somebody
Okay.
comes to the emergency room with a stroke, you want to have them with that IV drug. You want to have diagnosed a stroke, IV drug within an hour. It's a little bit different in Nigeria depending on how close you live to a hospital, but
That's
the
another
target,
issue.
yeah, but the targets still remain. You want to get treatment as fast as possible because every minute makes a difference.
Right. Now let's actually talk about some risk factors because when we talk about certain things, we have to figure out what or how a person can be at risk for stroke and try to reduce it as much as possible. So I'd like you to help us with that.
Yeah, the in Nigeria, the main risk factors: high blood pressure, diabetes, obesity, high cholesterol,
Hmm.
smoking, and those that live a sedentary lifestyle, meaning very little activity.
Right,
Right
right.
in our area here, 50% of the strokes can be attributed to something to do with blood pressure, poorly controlled or untreated blood pressure.
Mm,
So if you talked about how can we reduce it? If people just check their blood pressure regularly, that
mm-hmm.
would that would
Actually help
alert
a
us
lot.
to half of them. You know,
Mm,
and if it's that you are overweight, try and lose weight. There's ways to lose weight, and it's not all about just running to the gym. We've talked about that before. Maybe
yes,
we'll
we
have a
have.
show. We'll have a whole show on that. But exercising regularly, avoiding smoking, reduce
Mm,
your alcohol intake, and if you have high blood pressure or diabetes, it does increase your risk by a lot. But if the high blood pressure and diabetes are well controlled, your risk
right.
drops back down again. So having follow up, just because you've been using the same medicine for 3 years doesn't mean you don't need to test or you don't need to
Right.
have a checkup, because sometimes we have to adjust the dosage, whether it's up or down, and all of that
Oh,
is just to keep you in
okay.
very well controlled. So those are some of the risk factors and the best thing to reduce it.
Now that is something impressive. Thank you so much for highlighting that because some people will wait till it's actually happening and
Mhm.
think, oh, okay, the doctor says it's until you see symptoms or you things are happening to you. That's when you get to the hospital. But they also ignore all the signs, talking about people who have high blood pressure, people who are diabetic, who those who drink a lot of alcohol and all that. They'll just
Mhm.
no, it's there's nothing. All I need to do is just drink some water or sleep, and everything is fine. And it could equally be at that particular moment that it
Very,
deteriorates.
very true. Very
Very
true.
scary. Very scary indeed. But Lagos, we'll take a quick breather when we get back in. There's so much more that we're going to be touching on, especially when it comes to the myth. Yeah, I can't wait for Dr. Ajayi to get into this one. Especially how it is that some people have some interesting take where traditional remedies are involved. We'll touch on that, Lagos. Don't move a muscle, Lagos. Stay glued to your radio. Smooth 98.1. Honestly, I can't wait to talk about those interesting remedies where people are
I love it. I love it too. Myths are interesting to talk about.
honestly, it's how some people swear by it and tell you, it worked for so and so. Don't worry, it's going to work for you. And then they drink all the concoctions. Oh my
Yeah,
day.
I'm struggling with some patients that like right now that do that. When I heard, I just stared. I just stared at her. I didn't even say anything. She said, "Doctor, did you hear me?" I said, "Oh, I heard you. I heard you. I just don't have anything nice to say yet, so I want to keep quiet." Somebody I gave medication to. I said, "Try it for a month. Let's have a talk." She said, "Oh yeah, I found this thing on Facebook."
Oh,
So I
oh
started.
yes, that is for the older folks. That's where they get all their remedies,
Yeah. I said,
and they
"Really?"
swear by it.
They swear by it. Yeah.
Very
She wasn't
interesting.
even a week into the therapy, the treatment. It's not like she was having side effects, but she
Okay,
just started this thing that she saw on Facebook because everybody said to use it. I said, "Wow."
it's oh well. It's really interesting how they stick to their guns when it comes to those remedies and tell you, oh, that's the only way. If you're not using that, then you're not ready.
Hmm.
It's hmm. I have a lot to say, but I'm actually holding my tongue in.
I, I, I am too.
Oh my days! Because why would you want to put yourself through such um risks? All because someone Anyways, we'll touch on it. We'll touch on it.
Oh, and she had a stroke before already. So
Oh my word.
this is in between. She had this is the one I'm talking about, the same lady that I quickly saw that she had a stroke, and I put her on, medications, and now she's fine. Is the one that said she saw something on Facebook, and that was what she switched to. I just looked at her. I said, "Oh my!" I said, "It's because it's not your fault. It's because you didn't die. You're not dragging your leg. That you're taking chances with your
Exactly. That's
with
why
your
they
life."
take chances
Because
because
because I caught it so quickly that treated you well. That's why you're thinking it's a joke.
I know the doctors just want to extract money from me. It's there's nothing wrong with me.
And you may not believe she has an HMO. The HMO was paying. This woman just want this. That's how bad it is. Just wanted to really believe in this Facebook treatment. She had an HMO. She wasn't paying for the drugs. I cannot make this up. I can see her face in my memory. But it's not. She's not the only one.
But what? What? I don't know. Is it a thing about age? That is an interesting perspective. But anyways, let's get back into the conversation. Hmm. All right, Lagos, it is 34 minutes gone past 5. You are tuned in to Smooth Health here on Smooth 98.1. Today we are understanding stroke. And my guest this evening is Dr. Abiola Ajayi. He's the MD, CEO of ROA Specialist Hospital, and he's been giving great insights, the things to look out for. But now, beyond the medical facts, we'll be touching on things that circulate around stroke, especially some very dangerous things that individuals practice. We'll also be touching on myths, those false things that you've heard, and people just decide, oh, okay, they've seen it somewhere, they want to practice it. Well, thankfully, I have someone who's well versed in this and can actually help debunk them. But let's start off with this one that some people swear by. They say it's only for the older people that get strokes. Is that true? It's only the elderly that can be affected by a stroke.
Yeah. Strokes are. So the answer is no. The youngest person I've treated for stroke was 20s, in their 20s, 20 mid 20s.
Oh my word.
So they're more common with age, but young adults are not exempt. About 15% of strokes worldwide are people less than 50. So in Nigeria, 30% are less than 40. 30% of strokes are less than 40. So um, the best thing is for you to know your numbers early, your blood pressure, your blood sugar, your cholesterol. You
Right.
should be checking those things from, age 30. People should be doing checkups regularly once a year, at least from age 40, if not sooner. And
Okay.
but it's not true that they only affect the elderly. Hmm.
At least now we know better and we can debunk that one because it's not only it's not only about the elderly. If a 20 viral 25-year-old, 26-year-old can be affected by a stroke, best believe it can be you as well. Now let's get into the one that's very scary. And this one, I don't want to just say it's a lot, but some people believe and swear by all those traditional remedies that they say all those herbal mixtures. Oh my days, it reverses stroke. All the symptoms gets out. What's your take on that, truly?
So it's concerning. Many stroke survive. Sometimes you can have a stroke and you're dead on the spot, right? So
True.
anybody that doesn't die right on the spot is a stroke survivor. So in Nigeria, 43 to 45% of survivors end up using some kind of herbal medicine. That number is far too high. They're doing it often, expecting a faster recovery. Um, I saw two studies before coming on the show that showed that, yeah, Nigerian survivors typically often visited herbal centers because they
Mm.
believe hospitals do not have all the care, or they thought that they would get an even faster recovery. But you remember I said that there's two types of stroke. One that's
Right,
a blood
right.
clot, one that's
Mhm.
excess bleeding. So if you don't know
Which it
let's say
is.
you treat one like a blood clot, but really it was the other type, you're
Oof.
gonna make things 10 times worse. And if you do the other one, if you treat the burst vessel like it was a blood clot, you can
Mm-hmm.
also make things worse. So, these traditional or herbal centers, are they doing MRIs or CT scans?
Mm.
Do they first know the difference between a hemorrhagic or a bleeding or a ischemic stroke, or they start giving, what I think they do, they give drugs and herbs that break down clots because those are easier to find in the most common stroke is a stroke with a blood clot, but not all strokes are, right? So over a
Okay.
million a year are the other type, and if you, like I said, treat them the opposite, then you can make things much
Make
much
things
worse.
worse.
And then on top of that, you're delaying the true. You remember we've been talking about getting help on time. 2 million
Mm-hmm.
cells
Mm-hmm.
die every minute. You're delaying the real treatment. The real treatment is getting a CT scan or an MRI and getting on the medications. Between after you've to recover from the stroke, sure, we can talk about supplements, we can talk about herbs, we can talk about healthy living. Fantastic, but let's get through this phase first, so you don't end up having another stroke quickly. Because once you have a stroke, you're more likely to have another stroke. Your risk goes up. So let's try and keep you from having a deficit, a speech problem for the rest of your life, or a tremor, or a weak arm, or a weak leg. Let's do the medical treatment, and then we can talk about alternative treatment when things are calmed down.
Okay. Now talking about speech pattern, or because most people usually say that's the first sign you know that a person has been affected by a stroke or has a stroke. Can you explain why strokes can present differently in people?
Yeah, some people think that if speech isn't affected, it's not a stroke, or if movement isn't affected, it's not a stroke, and that's just not true. I think we all know that different parts of your brain control different parts of your body.
Very
And
true.
you even have different parts of your brain that control your personality, control your speech, control even how you understand speech. So it just
Mm,
depends on where the stroke happens, because
okay.
stroke doesn't happen at the same place every time for everybody. It can
Mm-hmm.
happen in the area that controls your eyesight, then you'd be blind. It can happen in the area that controls your speech. You have
Mm-hmm.
something called an expressive aphasia or a Broca's aphasia, where you as the patient, you can think of what you want to say, but you just can't get the words out.
Can get them all.
Then there's another type of aphasia where you can say things, but you're not understanding spoken speech, right? So people are talking to you, you're not understanding, and but you have the ability to talk. All of the reasons why you have different expressions is because depending on where the brain, which area of the brain is injured, that will now
Mm,
tell us the exact stroke symptoms. You know, the left side is usually for speech, right side is usually left-sided strokes usually affect your speech. If the stroke is on the right side, for most people, your speech is
mobility.
not affected. So
Okay.
these are all. This is also why a CT or an MRI is useful. So if you
Mm-hmm.
see the area and then you match the area with the deficit, then you can now know what type of physio or rehab to do for the patient. It's not just one treatment suits everybody.
Now, that is something very important, especially for those who are constantly trying to get help. But talking about this journey towards survival or trying to fight whatever it is that you're trying to get away from, let's talk about recovery for those who are on a path to recovery, or even those who have a stroke who are still thinking of how they can go about it. What does rehabilitation really involve? I know some some have said it's more about the physical one. That's why you see them go for all those therapy sessions where rather than meet get the recommendation from a doctor, you just hear them go to one local person who can, as they say, he knows how to massage. Once he massage your bone, it's okay. You're good to go. And yeah, like a newborn. And it worries me that sadly, this is the pattern that a lot of people go through, just like you earlier stated regarding how people just do one size fits all without having the exact diagnosis for their situation.
So, we were just talking about different areas of the brain, and wherever it's affected, that's how the person is affected. And
Uh-huh.
some of the areas are responsible for personality, right? So
Mm,
personality has nothing to do with your muscles. It has everything to do with the kind of person, what makes you you. So
okay.
we have to understand rehabilitation is physical, mental, and emotional. And rehabilitation starts as early as medically safe. And usually, like for my patients, if there's a physical deficit, I'll bring physiotherapy, coach them along of how I want. But if it's a speech
Mm,
deficit, I'll bring in a speech pathologist or a speech therapist and let work with them. If it's emotional therapy, I may bring in a psychiatrist to
okay.
work with them. But you need to know, of course,
Oh, exactly.
what you're trying to achieve. Start early, on time, and then you just try and regain function. But it's not always about physical rehab. A lot of times people have a stroke and their motor may be fine, but it's
Mm,
their mind, it's their emotional centers that are affected.
okay. So, for those who have been survivors, um, are there realistic chances of a full recovery, depending on how early the treatment starts?
Yeah, very, very much so. Closer the closer you are to your symptoms, we talked about facial,
Mm-hmm.
uh, face, arm, speech, balance, eye problems. The closer you get help to when the symptoms started, the
Mm-hmm.
more likely you are to make a full recovery. And sometimes the numbers are in the above 90%. 90% will make a full recovery if treated within 5 hours. There's a lot of strokes like that. So,
Oh,
not saying that 24 hours you can't make differences. Yes,
right.
you can. But a week later is very different than 24 hours later. And I cry for people all the time. I see somebody that had a stroke 6 months ago, and they're coming now asking, "Oh, what can I do, doctor? You have to do everything." I was like, "Man, the time has gone, to when where we could really make a difference. But we'll still try. But it's what do you call linear? It's very linear, meaning that the closer you are to the symptoms, definitely the better you're going to do."
Ooh, that definitely has been an insightful conversation. Thank you so much, Dr. Abiola Ajayi, for breaking it
My
down
pleasure.
so clearly for us. For those who are listening now, how can they reach out to you to get further insights? Your social media handle that they can always, say, okay, I listen to you. I know someone, or I have other things that I need to deal with, but I don't want to
Yeah,
put it on air. So, but
I get
I
it.
need your help.
I, I get it. You can call me 0913-579-5108. 0913-579-5108. I'm extremely active on social media, so that's ROA Specialist Hospital at that's Twitter and Instagram. I'm sorry, Facebook and Instagram, and then ROA Hospital on YouTube and Twitter. And we answer questions. I answered maybe 30 questions last night on Facebook. So wherever you can reach us, or you can go check us on the website www.theroahospital.com.
Mm. All right.
It's been my pleasure.
Thank you so much. It's been a pleasure. I don't take the time out you share with us for granted. I trust you will definitely have a pleasant evening.
Thank you. Cheers.
All right.
Bye for
So,
now.
all right. Thank you. If there's one thing I know that I've taken away from this conversation today, it's one thing that you need to bear in mind that stroke, it never gives you a warning, and your body can just snap at any point in time. So aside learning the early signs, you want to also take action as early as possible. And let's try and stay away from the myths and get the right help that you need. You just might be able to save that loved one or yourself, depending on who's hearted. Thank you so much for listening to Smooth Health today. It comes your way every Thursday from 5:15 and Lagos. Please take good care of yourself.